Hello, and welcome to today's brief webinar, where we will be discussing returning to activities and the decision-making process involved in returning to activities in the midst of a pandemic. I am your presenter today. I am Craig Escudé. I am a board-certified fellow of the American Academy of Family Physicians and the American Academy of Developmental Medicine. I've practiced clinically for more than 20 years, providing health care for people with intellectual and developmental disabilities as well as serious mental illnesses. I was the medical director of Hudspeth Regional Center for most of that time. While there, I founded a program to provide training, education, and clinical support to healthcare providers in community settings who were seeing people with intellectual and developmental disabilities. I'm currently the president of Health Risk Screening and the author of Clinical Pearls in IDD Healthcare and the Curriculum in IDD Healthcare. When we talk about assessing risk, we have to weigh the risks and benefits to just about anything that we do. But sometimes having a defined process to do this can be very helpful. It's also really important to consider when we're talking about helping people with disabilities make decisions that we consider what's important both for a person and what's important to a person. So things like healthcare are often important for a person, but things that may be more important to a person are spending time with friends and participating in activities. And thinking about what's important for and to are fundamental components of person-centered supports and services. So having this forum can also help people consider all of the various options and possibilities and help people make a more objective decision. We know that COVID and other easily contractable illnesses increase health risks. They can increase the health risk for long-term hospitalization, for long-term complications from the illness, and also increase the risk of death. But we also have to consider other increased risks that are associated with social isolation, things like anxiety, depression, abuse, and just loss of supports in general. We see these things increasing the more people are socially isolated, the less they interact with others. So it's important to consider all risks. And so what we're going to present today is a risk assessment document that can help you, the person who's being supported, and their family make decisions about returning to activities and if the risks outweigh the benefits or vice versa. Using this form can help provide a consistent way to make decisions and can help show that there was an objective process that was used to help determine whether or not the risks outweigh the benefits. The clinical advisory team here at Health Risk Screening consists of several members who collectively have really more years than we'd like to admit, um, uh, providing health care and supports for people with intellectual and developmental disabilities. And we created this form to help people think about as many things as possible in determining whether or not the benefits outweigh the risks in returning to activities. This form is in a fillable PDF format, and you can download it and reuse it and quote save as for each activity for a person so that you have a record that a decision was well thought out. So let's take a look at the form itself. I do want to say that this form is to help you to think about as many things as possible in making a decision. It's not going to make the decision for you. That's too much of an individual decision based on too many different factors, and the team and the person themselves and their family are best to make the actual decision. So the form starts with name, birth date, diagnoses. It's important to list the diagnoses because we know that some diagnoses carry more risks with them. The next section talks about event details. So what is the event that we're looking at here? The type of event? Is this a recurring activity? How often does it occur or reoccur? Or is this just a single event? Um, the next section looks at personal risks. So it talks about the person's ability to uh, participate in preventative measures such as social distancing, hand washing? Can they wear a mask? How long can they wear a mask? Can they complete these activities or participate in these preventative measures independently, or do they need assistance? So the next section looks at situational risks. These are things like the level of community spread in the location where the activity is going to occur. Is this considered reasonable, or is it considered a high risk area? Are there local ordinances in place relating to preventative measures that must be adhered to? Is there a higher risk to people who live with that person? If that person is exposed to a particular illness and they bring it back home, are they increasing risk for others around them? Does the place have policies or procedures to help reduce the spread of infection? Also, it's important to consider if there's a virtual option for this event. Can this event or activity be participated in a virtual manner that is safe? And would the person receive the same benefit? The next section looks at health risks. So we know that there are some health conditions, co-occurring conditions that increase the risk of poorer outcomes with this particular illness. Things like diabetes. Is a person obese? Their age is important to know and consider. Are there any respiratory or cardiovascular issues? Any other immunocompromising conditions or medications that suppress the immune system? Kidney disease, we also know, is a risk factor. Any other particular issues? And also, um, you know, if there is a vaccine available at the time, what are the current recommendations? And has this person had the vaccine? Are they up to date as per the current recommendations? And then we must weigh these risks against the potential benefits. So is socialization important to help this person manage things like anxiety or mental health issues or behavior? Is routine important? Are we changing the person's routine too much by them not participating in that? Could that cause additional issues? Does the person earn a wage? Is this a work activity? And does the person, participate in this activity and earn a wage? That's also an important consideration. Is this activity important to maintaining relationships with friends and families and others? Does the person feel a sense of pride and accomplishment in participating in this particular activity? And how do we assess that, or how do we determine that this is so? Does the person interact with people without disabilities? We know that's an important part of an integration and community integration as well. And is there positive reinforcement that's received from others when this person participates in this activity? Then there's also a section for additional comments, and then a signature. On the next page, there's a place to document the date of the meeting, and also a place to document the decision that the team conferred with the person, and that it was decided that the benefits outweigh the risks, or the risks outweigh the benefits, and why. Then also the person's contribution as to whether or not they agreed with the decision that was made, or they disagreed, and why or why not. And is there something that the team can do, or what has the team done to help reach a compromise and help create a better understanding between the person and the team if there was a disagreement? On the final page, there's a place to document which team members were present. Also, about conferring with the primary decision maker for that person. Who are they, and were they informed of the decision, and did they agree with the decision that was made, and to document whether they agreed or disagreed. And then, of course, signatures for everyone involved. So this form is downloadable. It is free. You can download it and reuse it as often as you like. It's found on the HRST online COVID-19 resources webpage. You can see the website there, or you can just go to hrstonline.com and you'll see the link to the COVID-19 resources page. Again, you can fill it out and save it as a new copy for each activity that the person participates in, and for each person. And this helps to give you a way to document what was that a thoughtful decision was made as to whether or not a person can participate in a particular activity. And just as a reminder, keep doing what you can to prevent the spread of COVID and other infections. Wash your hands, sanitize things that need to be sanitized, wear masks, practice social distancing. More and more studies are coming out that show that people with disabilities are at greater risk from dying from COVID-19, as many as 3 to 4 times the risk of people without disabilities, and also at greater risk for even contracting COVID. There are also studies that have come out that show that preventative measures do indeed work. One study done in 2020 shows that strict social distancing during activities can reduce the spread of the COVID virus. Another analysis of 172 studies published in The Lancet on June of 2020 showed that mask wearing significantly reduces the risk of transmitting viruses. And there are numerous studies that show that hand washing and hand sanitizing helps reduce transmission of infections. On behalf of the clinical advisory team here at Health Risk Screening and all of us at Health Risk Screening, we thank you for joining us on today's webinar. If you'd like to learn more about other products and services of Health Risk Screening, you can visit us at hrstonline.com. Thanks again and stay healthy.